Good morning, everybody. I agree with Dennis. It's amazing that you all showed up on Saturday morning. I wouldn't have thought it was possible, so yay for you. And I'd like to thank Banker Victory, too, and Jim, because they have taken this on board, and OCFS in New York State, who have really supported adopting the sanctuary model in a lot of the voluntary residential programs and all of the juvenile justice programs. So it's pretty exciting, and as usual, New York is ahead of the curve. It's very cool. So I want to tell you what the sanctuary model is about, and you can determine how helpful it might be to your efforts as a whole community. We usually introduce the sanctuary model into an organizations, and thinking about it as really applying to a whole community is a little bit expanding our thing. But I think it's the same principles because I think they just apply to human beings. What do you see here? A horse? Who said frog? Who said frog? Yeah. All right, everybody else see the frog? There's the frog. See it? See the horse? You see the horse laying down. I want you to see the frog and the horse at the same time. You got it? Okay, there's the frog. There's the horse. You got it? All right. I want you to do that because I want you to keep in mind everything that we talked about yesterday. And I want you to transit with me into taking all that to a whole different level and applying that knowledge that and I think everybody was using to think about their clients and the people they've worked with, and probably yourself, into your organizations and your whole community. So the same kind of concepts, but now at a different, more collective level. Okay, so you have to keep them both in mind at the same time. My basic assumption is that organizations, like individuals, are living. They are alive. They are not machines. They are not things. They are complex adaptive systems. And because they are alive, they are vulnerable to stress. And like us, because they're entirely comprised of us, they are vulnerable to chronic and repetitive and toxic stress, and of course traumatic stress as well. Organizations can be traumatized, and the results of traumatic experience can be as devastating for organizations as it is for individuals. So as you move ahead, I'm sure that you are like other cities and other communities, that there are conflicts between and among agencies. If you're going to do an effective community collaboration to address these issues, you will encounter those kind of conflicts. And the worst kind of conflicts often arise from trauma. Trauma in organizations. Trauma that occurs, all that has to happen is one bad thing in an organization, really bad thing, and it affects everybody that works in that organization because we are all connected to each other. We are complexly interrelated. And once you join a group, the group becomes part of your own individual identity. So groups can be tolerated, organizations can be tolerated, and as Katie referred to, whole communities can be traumatized. That happened in Oklahoma City. That happened at 9/11, and not coincidentally, it's been Oklahoma and New York who have most embraced the sanctuary model. And I don't think that's a coincidence. I think it's because of that general public increase in awareness that this stuff means something. Well, what I'm asking you to do is think in parallel. And this is a notion of parallel process that we use a lot in sanctuary. This is from a guy named Kenwin Smith, who is on the faculty at Penn School of Social Work and at the Wharton School. And this is actually, he does now a lot of work consulting to businesses. And this was a quote from a paper that he had been doing a consultation on in an industry. And he said, when two or more systems, whether these consist of individuals, groups, or organizations, have significant relationships with one another, they tend to develop similar feelings, similar behaviors, and similar thoughts. That's what we mean by parallel process. But these parallel processes that occur go on largely at a level of the unconscious in a group. They're under the surface, not obvious until you see them and you make them obvious. But it is really where things fall apart. And as a result, our systems frequently recapitulate the very experiences of abuse of power and disempowerment and trauma that have already been toxic for the people we're supposed to be helping. So lots of times people come into our service systems and they don't get much help, and sometimes they get less than help. They get hurt. And that should never happen. And it shouldn't happen to them, but it should never happen to you, because nobody goes into this work to have that happen. Nobody, you should never have to walk away from any job that you have in social services and wonder whether you did more harm than good. Never. Because you don't get paid enough. You get lousy pay compared to a lot of other people in our society, and therefore it has to be compensated for by something else other than financial reward. And for most of us, that is feeling like we did a good job and that we helped people and that what we did worked. So to ever have something happen where this instead is what occurs and people don't get hurt, they don't get the help they need, and you feel ineffective, it just should never happen. But to prevent that from happening, we believe that you really have to understand more about the way systems work and the way groups work, both consciously and unconsciously. And as we were talking yesterday, and in the breakouts and the feedback from the breakout, you're talking about changing your whole system so that it works better, so that people are aware of this whole issue of trauma and abuse. Which raises the question, does system change ever work? How many of you have been involved in a system change effort in your life? Right, lots of you. Have they worked? Have they lived up to your expectations? Some. Good. Okay. Well, according to a study of businesses around the world, 70% of change efforts fail. Now, this is not just social services. This is all kinds of companies. 70%. That's a lot of work going for nothing. How many change efforts directed at the people we serve will fail? Just will not work. It's kind of an open question. I don't have the answer to that because I don't think we know the answer to that. But a lot. And what is the reason for that? Well, a lot of people now think that it's the approach that's wrong. That in the last, 50, 100 years, efforts to change systems, to change whole systems, to change big industries, to change individual organizations, have been built on what's called social engineering. So listen to that word a minute. Social engineering. It implies that what you're changing is a machine. It's something that engineers would do. And that's like a fatal flaw, because our systems are not machines. As I said, they are living things. And trying to socially engineer them, which means somebody at the top decides what needs to be done and tells everybody else in the next level down what to do, and they just do it. And it all works, which is why 70% of those efforts fail. Because that is not the way human beings function at our best. So social engineering, what the business world is coming to, and a lot of this conversation that we have about sanctuary, a lot of the formal research comes out of not our world. It comes out of the business world, because that's where most of the organizational development literature really exists. So what's being said now is that social engineering as a context is just obsolete. It doesn't apply. It's inappropriate. That living systems isn't a metaphor for how human institutions operate. It's real. It is the way it is. That may sound abstract to you right now, but over the course of the next couple of months, when a policy comes down from on high, when you see something in the newspaper, when you're thinking about a policy change within your own organization, think about the basic assumptions that are going on and how your organizations are being treated and how they actually need to be treated, which is as living systems. You can't approach them the same way. You have to know something about human nature to change a human system. It's not a machine. So, if we look at the parallel process notion, these are our clients. They, quite frequently, because of what we talked about yesterday, lack basic safety and an ability to trust. They just don't trust people because of all the bad things that have happened. Their ability to self-regulate their emotions, to manage their emotions, is often quite compromised. As a result, it interferes with learning and memory in all kinds of ways. So there are all kinds of cognitive problems. All of that leads to difficulties in communicating openly and directly with other people. If authority figures have repeatedly failed you, then you are quite likely to develop some kind of problems with authority. And it can look like you're too susceptible and eager to please, or it can look like you defy, but it's all about problems with authority, both external authority and with your own sense of authority in running your own life, things like self-control and self-discipline. You're likely to have a very confused sense of fair play and what's right and what's wrong and what's fair to you and fair to other people. And you're likely to have a lot of trouble grieving because that requires the ability to manage emotions. And that's tied to the ability to imagine the future. That the same parts of the brain that are impacted by toxic stress are the parts of the brain that also allow us to consider the consequences and use of our actions and imagine into the future. So that's kind of a summary version of what most of our clients, it doesn't matter what area of social service you're in, this would probably cover the ground. Well, parallel to that is us. And in reality, when you look at people who work in social services, when we look at an ACEs questionnaire for us, it doesn't look that different. If anything, it's higher than what Rob showed yesterday. We've done it on about 350 of the people we trained. Rob has done it. We've done it at Andrus, where my partners in the sanctuary. And at Andrus, it's like 80% of the staff had elevated ACE scores. So does anybody want to disagree with that? Or does that sound like it's consistent with what you know? So the staff then often lack a feeling of basic safety where they work. They lack trust in the people that they work with and in the people that they report to. The work is very demanding, and if you already have trouble with emotional management, then the work is going to be even more demanding of what you're kind of short on. Many people are going to have difficulty with thinking clearly, particularly under stress, because of what we know happens to people with elevated ACEs score. They're likely to have very similar communication problems and problems with authority and not be exactly sure what values underlie, what are the values premises of the work that they're doing, and often have difficulty in change. The inability to grieve means that you have a lot of resistance to change because all change involves loss. You can't make any change without giving up something. So if you can't do grief work, then you're going to resist change. And part of what drives that resistance is the inability to imagine anything could get better. So that's what we mean by parallel process. On top of the clients, then you got us with all of our own baggage. And then there's the organization as a whole. So we believe what runs in parallel to those are the very similar problems. A lack of basic safety and trust that is throughout organizations, the loss of the ability to manage distress, problems with critical thinking, being able to incorporate science into practice, being able to complexly resolve complex problems, breakdowns in communication, and if you look system-wide, you'll probably see that you exist in silos, that your community-based system is quite siloed, because I don't think you're probably very different than anywhere else. That, child welfare and mental health don't necessarily talk to each other, and domestic violence and mental health and child welfare not so much, and all kinds of differences in languages and basic assumptions that interfere with really the ability to get on the same page. Problems with how we manage authority, and I'll get more into that. A confused sense of what is really fair, and an inability to rapidly change and transform to meet current needs, to meet changing needs, to meet stressful kinds of needs. So that's what we mean by parallel process. Organizations, we believe, are living cultures. And what does that mean? Well, every organization and every component of your social service system has an organizational culture. That is the pattern of shared basic assumptions that a group has learned over time as it's solved its problems, and it's worked well enough to be taught to new people who join the organization or the system. It's kind of how we do things around here. It's the accumulated wisdom, and organizational culture is largely unconscious. The sanctuary model is directed at changing organizational culture. It is not a trauma-specific approach. You have an organizational culture. You knew its rules within about the first 24 hours that you went to work there. We pick that up very, very quickly. It's part of our group heritage. So we know the rules, the norms of a group very, very quickly. That doesn't mean that you presently have an organizational culture that you want to have, and it doesn't mean that you necessarily have a healthy organizational culture for you to work in or for you to do the work that you have to do, because it arises spontaneously. And unless we deliberately work our culture, it just arises and it stays there. So your organizational culture may actually reflect the group identity of people 100 years ago. Because unless you change it, it doesn't change. So if you want to change your organizational culture, then one of the questions becomes, how do you get a lot of people from diverse backgrounds who have a wide variety of experiences on the same page, speaking the same language, sharing a consistent, coherent, and practical theoretical framework? And when that's hard enough in an organization. When you take it up to a whole community, it's even more challenging. Same questions, though. Because if we don't share the same language, and we mentioned this yesterday, if we don't share the same, and there's no framework, and it has to be a theoretically based framework, because there's never going to be a manual that will instruct you in every different setting how to handle every different kind of situation. So you have to know how to think differently about the problems. And we have in any community people with a lot of diversity. So there's diversity around culture, ethnicity, and race. But there's also diversity around education and age and gender. And all the differences that are our strengths are also our vulnerability, because it means we can't just assume that when we say something we all understand in the same way, that we understand the same things. So we need system interventions. They're absolutely essential to go forward, but they're really tricky. And you have an organizational culture. If you put people together for a long enough period of time, an organizational culture will inevitably emerge, but it may not be the one you want, and it may not be a particularly healthy one for anybody. So the sanctuary model, am I going in and out? Hello. Okay. Now, it's okay? Okay. It's theory-based, and you heard a lot of the theory yesterday about trauma and attachment that it's based on. But it's also based on a lot of theory about how groups work. It is certainly trauma-informed, and it is an approach to a whole culture. So if we think about the sanctuary model in terms of your community, then it's an approach to the whole culture of your community. I'm still fading in and out. Well, I've got that on mute so you don't get hummed. I don't know what's wrong with this. I'm going to put it there, and I'm going to hold this sucker. Okay. It's a whole culture approach. It's evidence-supported. Now I'm going to drive you crazy because I'm going to be knocking this thing. It's evidence-supported. It's not yet evidence-based. You have to have a number of controlled studies to really make something evidence-based. But we do have one controlled study, and so we become evidence-supported. And there's a very clear and structured methodology, at least applied to organizations. This is very irritating, and I think I'm just going to talk to you. Can you hear me? In the back? No. All right, well, I don't know what to do. And my patience is very short today. So I have no idea. And so, Jim, if you want to find a tech person, do it. Now? Okay. I'm not feeling very sanctuarized. Oh, really? Okay, so it is, sanctuary is an organizational change approach. It is not a trauma-specific treatment. And it integrates trauma theory with the whole understanding we have of how you create therapeutic communities. It's, other than the information about trauma and attachment, it's not new. When I describe this, you'll go, well, yeah. I mean, yeah. But it's the putting it all together that is what makes it an approach, a model. That's the only thing that's different. But you will have in common long-standing notions of how people need to be with each other. It provides a basic blueprint for developing a trauma-informed therapeutic communities that promote recovery and recovery from anything. And it takes advantage of what we know about human nature, about healing from injury, the power of group processes, and the way change occurs, which is not necessarily straightforward. Change is not really a linear process. It's much more chaotic than that. And understanding chaos theory, and I know that sounds pretty abstract, but there are some pretty good management books out now to help people and not have to know the math, which I'm an idiot in math, but to understand how change occurs. And living systems exist on what's called the edge of chaos. And that's where life occurs, that's where change occurs, and that's where healthy organizations exist. And that's a pretty scary notion for a lot of us. And it's a scary notion for the people who are in charge of our systems. Because it means, being on the edge of chaos means that you're always walking on this fine line, and you're trying to keep your system from becoming truly chaotic, but also keep it from becoming stagnant and rigid. And it's not easy. Think about your relationships, your significant relationships, your families, how things can really get stale and boring, or they can feel completely out of control. But having it right on that edge where it's exciting and interesting and you're learning something, but it's not too crazy making, it's tricky. But that's where change occurs. So the sanctuary model is about how do you keep enough pressure on a system to keep it moving and growing, but not so much that it falls apart and is completely chaotic. I talked yesterday about this notion of relationships being the operating system, attachment being the operating system for human beings. And the way I see sanctuary is that it's an operating system for organizations. So on the bottom is the hardware, or your program, or in a community, all of your social service system. The buildings, the materials, the policy, the things you do. Then sanctuary becomes a way to organize your organizational culture. And then you put in the applications. And the applications are as diverse as the people that you serve, the people that you are, and the organizational mission that you have. So there may be all different kinds of approaches that then are directed at whoever is your target, if it's families, if it's children, if it's adults, whoever it is. And it means that for most systems to really become trauma-informed, they are going to have to change. They're going to end up retaining a lot of the things they're already doing. They're going to have to throw out the things that are incompatible with a healthy operating system, and they're going to have to get new approaches. So with all the organizations we work with, that's what we find. There's a lot where we are doing right and always have been doing right. There's a lot we need to remember about what we used to do right and we don't do it anymore. And then there are some things that just need to stop, that we need to say, no, that is no longer the standard of care or the standard of intervention. And then to really treat trauma, you have to adopt and learn new trauma-specific approaches, and that whole area is still very much growing. So there's a lot we don't know yet about how to really effectively intervene. So there are all kinds of things that might surprise you in actually treating trauma survivors, that don't have to be terribly complex, that don't have to need years and years of treatment, and that are really pretty innovative, that you will introduce into your settings as you learn. But that's kind of that's the way to think about it. Sanctuary is not trauma-specific intervention. You still have to do those. It is a way of organizing the organizational culture. And it's really a value system. So in an organization, how do we communicate values? All the time, in pretty much everything that we do. We communicate by what we reward. And that reward can be conscious reward in the form of money and prizes and things like that, or just by who gets attention. We communicate values by what we punish. When we withdraw, when we actively punish, or we withdraw affection. We communicate values by what we say and what we don't say. We communicate values by what we do and what we don't do. And what you can be sure of is that wherever there is incongruence, when the stuff, the value system that's on the boardroom wall or in your mission papers does not fit what actually happens when people join your organization, then your organization is going to be sick. Your system will be sick. If you're going to have an organization, it has to have operating principles, and those principles are our value system. And then they have to be actualized. So it's one thing to talk about them. It's one thing to put them in a document. It's a whole other thing to actually practice them. It's way harder to do. So Sanctuary, because we deal with very diverse groups, you have to think about what are universal principles. That it doesn't matter what religion you are, what ethnic group you are, how old you are, what gender you are, what your educational background is. There are just certain beliefs that are universal about human conduct and human needs that are common to all cultures around the world, regardless of all those differences. So that's what we've tried to capture, is what those universals are that apply basically because we're human beings and that are grounded in our biology more than even our psychology. What's that doing? Oh, okay. So the clients, the staff, the organization, I told you about that. And I put this picture up because I wanted you to see the overlay of our value system and how it fits. So the 7 commitments, the first is a commitment to nonviolence, and that's an overlay on top of the issue of basic safety and trust. The commitment to emotional intelligence in the organizational culture is about recognizing that as human beings, we have a lot of problems with emotional regulation. And they're across the board. It's everywhere, and the more stressed we are, the worse, the more compromised that capacity for emotional management becomes. The problems with critical thinking, with the ability to integrate theory and function in an integrated way, we call it the commitment to social learning. And it's about creating organizations and systems that are devoted to learning constantly. That we live in a changing world and you're always having to adapt and we're always having to learn new things. And if you think at any point in time that you got it, you went to graduate school, now you know everything, doesn't work out. The issue of communication problems and how easily communication in an organization is impaired by stress is reflected in the 4th commitment, which is to open communication. Open communication is nice, sounds good. It's incredibly difficult to do. Problems with authority are reflected in our commitment, which is a commitment to democracy. And I'll talk more about these. The confused sense of justice and lack of understanding or grappling with the issue of social justice is reflected in what we call a commitment to social responsibility. And the inability to grieve and to manage from the future is reflected in the commitment to growth and change. So those are the 7 sanctuary commitments, but they really look like this because they're inseparable. And there are really pretty arbitrary bracketing of different features of this because they all fit together and they all interrelate, and you can't take one away without kind of crumbling the whole thing. That's been our experience. This was not created by me, by the way. These ideas really have emerged out of a very big group process. With adding up all of our 20 years of experience with me and my team and all the people we treated, and then working with the Jewish Board of Family and Children's Services, and then with Andrus, and then with all the programs like Baker Victory that have been throughout New York and Pennsylvania and now a lot of other states and internationally. It's really a co-created process. But what emerged out of that was that these 7 commitments captured the pieces of the organizational culture that were critical for everybody in the organization to look at. So I'm going to take them one by one and talk to you about why they're so important. Why the commitment to nonviolence? Well, I think Martin Luther King summed it up the best. He said, "We've learned through the grim realities of life and history that hate and violence solve nothing. Violence begets violence, hate begets hate, and toughness begets toughness. It's all a descending spiral, and the end is destruction for everybody." Nonviolence is, in many ways, the most difficult and the most important, if I can put it that way. We are deeply biologically programmed to respond in kind. What our biological programming is really about is I do unto you what you do unto me, not I do unto you what I would have you do unto me. That's nice, but that's not really how it works. So we are basically, our basic program for relationships is reciprocity. So if you hurt another person, that other person will get even in some way. It's deep. It's a very fundamental, it is the basic computer language, if you will, of social relationships. And we, at our peril, do not deal with the issue, that basic biology of human beings. Because we have created an incredibly vengeful culture and an incredibly violent culture. It's everywhere. You cannot go to a movie, you cannot, well, you can maybe watch a Disney cartoon, maybe. But you can, it's impossible to get away from. And if we don't, as a species, not just here in America, but as a species, learn how to manage these basic inclinations, we are doomed. And I really believe that. I believe it just like he believed it. It leads to destruction for everybody. So this commitment is not anti-violence, and it's not violence prevention. It's way more active than that. It is the active commitment to a nonviolent community, and it is hard. Because when somebody crosses you, when they insult you, they disrespect you, they hurt your feelings, your very natural inclination is to respond in kind. And to not do that requires tremendous discipline and a spiritual commitment. Now, it's really, really hard to do and very challenging for organizations that take it on. And you really have to take it on as a really deep spiritual, life-saving mission. That unless we do that, things are not going to turn out well. They're just going to escalate. And if we escalate much further, we now have a mental health system, and I believe a social service system. I've just finished a book. It's in press. It's called Destroying Sanctuary, The Crisis in Human Service Delivery. And it's really about this crisis that federal reports talk about, but doesn't really seem to be getting much public attention. And the result of that is that you probably have a hard time, no matter what piece of the social service system you're in, of serving the needs of your clients. And it's probably been getting harder and harder as time passes. Can I see hands on that? That makes sense? Trust within organizations is absolutely critical. And if you want to do a community collaboration, as we've been talking about, it's going to mean having to create a lot of activity around trust building. And that is hard in large systems. We are designed, again, our biology, it's a number called Dunbar's number. We are designed to live in groups of 150 other people, max. And this is so real a number that there are some companies that build a factory, put in 150 parking lot spaces, and as soon as people start parking on the lawn, they know it's time to build a new factory because they know their systems are going to break down as it gets above that number. Think of our systems. Think of our schools. No wonder we're having such a hard time, because when you get beyond that number, because of just the ability of the human brain to connect, you have to create bureaucratic structures. You have to create hierarchies, and they tend to become more and more rigid. And what that means is that you get these breakdown in trusts in organizations that nobody really intends, but that happen anyway. And this is from a business book, it's almost impossible to successfully implement high performance or high commitment work practices in the absence of mutual trust and respect. But trust is missing in many employment relationships, and the atmosphere in the workplace is crucial. All workplace practices and changes should be evaluated by a simple criteria. Do they convey and create trust, or do they signify distrust and destroy trust and respect among people? Trust isn't something you can just count on being present in an organization. And trust is something that we often repeatedly betray. So we live in organizations where our trust is frequently betrayed, and we hold somebody accountable for that, and we don't necessarily do the repair work necessary to get that back on track. Because to do that, you have to really practice nonviolence, and you have to practice open communication. But trust, just as trust is critical for healing of our individual clients, so is it vital for us, so is it vital for our organizations, and vital for any community collaboration. And if you do a community collaboration, there will be times, because of the nature of us, when trust breaks down. You have to be able to identify it, and you have to be able to repair it. What kinds of things trigger mistrust? Things that many of you probably have seen. And it's things like, it's the overt stuff, publicly humiliating somebody else and not controlling your emotions. But it's also you're in a meeting and there's the eye roll. You know, the eye roll. When's this going to be over? You know that? So we have to be very sensitive that we're all different. And we need to be on the same page, but that includes being on the same page about how we conduct ourselves verbally and non-verbally. Because respect is absolutely critical for human interactions. Nonviolence is really about protecting your body's immune system, the social immune system that we create when we come together to work together as a community or work together as an organization. It's the social body's ability to recognize and respond to any kind of threat. And we need to have complex activities that get set into play to protect that social immunity. It's a very different way of thinking about violence. When a violent behavior occurs, so it might be a kid going in restraints, or it might be a nasty rumor that gets spread, or a backstabbing thing that went on. When that occurs, it means that there has been a breach in the social immune system. And usually what we do is, instead of looking at it that way, that what happened in our group, that breach could occur, instead we go after whoever we think has been violent and we try to punish them. And then we find somebody to blame, and then we can go, well, I took care of that. That's kind of throughout our whole social system. And it doesn't work very well. And it's because you really need to look at all episodes of violence as emerging out of a group. And what happened within our context that permitted that to happen. Why now? Why today? Why not yesterday? Why with that person, not the other person? What's going on with us? And it's really a very different way of thinking. And it has to include everybody to really be effective. Now, why the commitment to emotional intelligence? What's that about? Well, have you ever heard the concept of emotional labor? Nobody heard of it? You all do it. That's what you're doing when you go to work. You're doing emotional labor. It's also why you don't get paid very much. Because historically, emotional labor has been considered women's work. It's caretaking. It's being sensitive to other people's feelings. It's attachment behavior. It's all that. And it is hard work. It is why you go home at the end of some days or the end of some weeks and you are just completely wiped out. You might have sat at your desk the entire week, but you are completely wiped out because you put so much out in terms of emotional labor. It's work performed by any service employee who is required as part of his or her job to display specific sets of emotions, verbally and non-verbally, with the aim of inducing feelings and responses among those for whom the service is being provided. So it means that you have to control and use your own emotions all the time to try to change the emotional state of others. And let us remember that you are not operating in a circus environment. People aren't coming to be entertained and they're happy and excited. People that come to us are miserable. So what they bring into our settings is enormous distress. And you have to contain it, and you have to try to move it. That's your job. That's the emotional labor we're doing all the time. And that's why we really have to have systems that are very emotionally intelligent, that really understand what emotions are about, how they work, consciously, unconsciously, verbally, non-verbally, and how to move them. How do you get change in emotional states? All kinds of areas of emotional intelligence are vital to the work we do. And when things go really badly, there is often a severe lack of emotional intelligence. Occupations considered to be high in demand, no surprises. Nurses, physicians, therapists, protective service workers, and all health service workers. Absolutely, and parents, yes. And teachers, yeah. Yes, and teachers. You're absolutely right. Emotional intelligence is the ability to perceive accurately, appraise, and express emotions, to access and or generate feelings when they facilitate thought, the ability to understand emotions and emotional knowledge, and the ability to regulate emotions so as to promote emotional and intellectual growth. That's a lot. That's why it's such hard work. It deserves a lot more respect. And then there's the issue of emotional contagion. We have mirror neurons in our brains. We automatically mimic and synchronize our facial expressions, our vocalizations, our postures, our movements with those of another person. And when that happens, we converge emotionally with them. Now, as I said, you are dealing with people in a great deal of distress. And therefore, to adequately deal with them, you need to empathize with them, which means you converge emotionally, which means you get into their really painful place. And that's really hard work. And you have to be emotionally intelligent enough to figure out how much of that you can handle, what you do with it when you're in there with somebody else, how do you keep a sufficient distance, not too distant but not too close, so that you're able to be effective. Those are really sophisticated skills. And then there's the issue of collective emotions. Emotions are among the primary determinants of behavior at work, any work, and profoundly influence both the social climate and the productivity of companies and organizations. So this whole issue of the emotional climate and the collective emotions we create when we're in a system, vitally important to accomplishing what we need to accomplish. And then when you're talking about bringing a whole system together, then it's magnified, because there will be larger collective emotions that you can take advantage of that will propel change, but that also can get in the way if they're not managed adequately. The commitment to social learning is about learning, and it's about memory. And our organizations have different kinds of memory systems just like individuals do. And you can divide them into explicit and implicit. The explicit is contained in all of your records, the things that are written down, the history that gets written down. That's where, in any organization or any community, so there'll be a lot of, I was hearing on the cab ride in about the blizzard of 1977 and all the newspaper articles, and everybody remembers, or if you're not old enough to remember, you've heard of the blizzard of 1977, right? So that's codified. That's available. You can get details about it. Then there's this implicit wisdom, and that, in our fields, we've thought of that as clinical wisdom. And that is experiential and intuitive. It lies in the values and beliefs of the system, and it lies within the minds and the feelings of everybody that's ever been a part of the system. It's way more easy to lose implicit memory than explicit memory as a result. So if somebody walks out the door who has been in an organization a long time, they take with them a big chunk of the organizational memory. And whole systems can have memory impairments. The mental health system, how many of you are actually in mental health treatment? The mental health system is a great example of organizational amnesia. We keep forgetting knowledge that we gain. So this whole thing now, we're into ending seclusion and restraint, which I totally and completely support. Except that we've done that several times over several hundred years. And it's the same things you have to do again. You have to relearn it all again, like it's something brand new. It's the same for sanctuary, really. It's a lot of stuff that people have been doing. Sanctuary's rooted in moral treatment brought over here by Quakers in the 18th century. And every state hospital in the country was founded on moral treatment. And we got great results before there were medications, and people got better because of they were cared for, and they had good food, and they were in a nice climate, and nobody told them they were bad. And they got better. And we have to keep remembering that stuff. We will throw out whole bodies of knowledge. We will accumulate knowledge for 10, 20, 30 years, and then just throw it out. Flush it down the toilet and get the new flavor of the month. It's the oddest thing. But that's a loss of clinical wisdom over and over and over again. And people who are old enough in this room, I see a lot of nodding heads because you're old enough to remember. The problem is that if you, in this kind of thing, if you stop teaching one generation, the knowledge is lost. So all it takes is one generation of psychiatric residents or one generation of social work students, and the knowledge is gone, and they have to relearn it. It's no wonder we have to keep going backwards and come to the same place again, because we have this problem with organizational Alzheimer's. Traumatic experiences create amnesia in systems. Suicides, homicides, patient deaths, staff deaths, lawsuits, loss of funding, patient or staff injuries, episodes of sexual abuse, media attacks. Has anybody experienced any of these? Right. And they affect everybody. And there is a profound silence about these things. So when I was writing the book, I was trying to get research about how different systems deal with this stuff. I found a couple of articles about suicide on acute care adult inpatient units. I found a couple of articles about child protective workers. That's it. And I happen to know, we've trained over 100 programs, and I know every single one of them has had a tragedy. It's had some terrible thing happen. And yet there is this profound sense of shame that we can't talk about. And of course, what happens with all these things, lawyers come in, say you can't talk about it, and lawyers never come back in and say, okay, now you can talk about it. So it never gets worked through. It never gets retrieved. Just like trauma in an individual, it affects organizations and systems. When a company loses its medium and long-term memory, it repeats its past mistakes, fails to learn from past successes, and often forfeits its identity. Hard-won and expensively acquired organizational memory walks out the door every time an employee retires, quits, or is downsized. That's from the business. There's a whole huge literature in the business community about organizational amnesia because of the noticing all of the effects of layoffs and how you get short-term profit, but the long-term loss is enormous. Okay. Now, decision-making under stress, called part of social learning, is decision-making and problem-solving, and it gets worse under stress. As decision-making under stress becomes less participatory, problem-solving is likely to become more reactive, and you're likely to get more and more short-sighted policy decisions that actually make everything worse. Has anybody ever seen that? That's like in an inpatient psych unit. Somebody there's all kinds of dysfunction going on, and the patients respond to that, and somebody tries to kill themselves with their shoelaces, and nobody looks at anything else. All they do is create a policy that nobody is allowed to wear shoelaces anymore. Right? That's what I mean by that. Happens a lot, particularly under stress. Attention narrows. There's a focus on threat. Our cognition becomes more rigid. So in a group, it means everybody's cognition gets more rigid. And so groups can really go wacky. Groups of people can make terrible decisions under the impact of stress. And it results in premature closure. That means that we really are confronted with enormous complexity in the problems that are put to us, but because of premature closure, we don't really deal with the complexity. And so you often get simplistic solutions to very complex problems, and they don't work. So we keep, when I first started working at Andrus, the COO there said, before we started doing Sanctuary at Andrus, our policy was, if what we're doing isn't working, then we need to do more of it. Social learning is a term that comes from Maxwell Jones. Has anybody in this room heard of Maxwell Jones? Shout out if you have. Nobody. Okay. Every now and then I get somebody who has. Maxwell Jones was a Scot. He was a psychiatrist in World War II. He was one of the primary founders of the democratic therapeutic community, which is different than the concept therapeutic communities we have here as substance abuse programs. And it was built on democratic principles, and it was designed originally to treat trauma survivors after World War II. And I urge you, if you've got access to a library anywhere where they still have his books, they're wonderful. They're out of print, but they are fabulous. And it's really about how you conduct a therapeutic community. And he was the one that really talked about social learning. And he said, describes, way before there was any conversation about the learning organization, he said, describes the little understood process of change which may result from the interpersonal interaction when some conflict or crisis is analyzed in a group situation using whatever psychodynamic skills are available. And now, the current notion in the business community is creating a learning organization, which means an organization that facilitates learning in everybody and is continually transforming itself. It means one that has a climate in which every individual is encouraged to learn and to develop their full potential. It extends the learning culture to include everybody that is a stakeholder. And it makes a human resource development really central to organizational policy. It's a recognition that if your workers aren't okay, then the organizational mission cannot be completed. And it's continually undergoing a process of organizational transformation. So we're constantly learning from our mistakes rather than running after trying to find somebody to blame for something that goes wrong. We're creating, imagine if the whole system, so from central offices all the way down, federal, state, and local systems were designed to constantly learn rather than to blame and punish. Imagine how much more effective we could be. The commitment to open communication is because that's how we pretend communication is between people. This is how it really is. So, to talk to you about this, I have to find a way to encode a message that I want to get across to you. And then I got to get it across to you, and you have to receive it, and decode what I'm saying. And then you have to create and encode a message back to me. Then I have to decode what you said and receive it. And anything can and often does go wrong in that process because there are so many barriers to adequately understanding each other. All that makes us diverse and that therefore strengthens our capacity to deal with complexity also makes communication challenging. And as long as we pretend that it's like this, then we can't really deal with the issues. So it's really important to have structures where you clarify, do I mean the same thing? Do the words mean the same thing? And when you talk about cross systems, this becomes vitally important because you may not mean the same thing. The assumptions that you have in each system about the people you're working with may vary greatly. And you have to clarify those assumptions to actually communicate effectively. And then under stress, communication really goes south. So perception's narrow, context of information is lost. It's been well studied. What happens in organizations is that when they're under stress, there's more top-down communication, less bottom-up communication, which is fine in a true emergency. When you got to get everybody on the same page like a fire drill. That's fine. Tell me what to do, I'll do it. But over time, when stress is chronic, as it is with our clients and as it is with our systems, then what you get is this systematic loss of important information. And you get more and more of a rigid hierarchy. You get more and more broken feedback loops. And in organization, the communication network is analogous to the veins and arteries in our body. And if they get blocked, you start to die. One of your organs dies or you just die. And it's the same in the organization. If your feedback loops aren't working, if your communication is blocked, then your organization is getting sick. Under those conditions, we're likely to go back to just doing whatever we know how to do, whether it works or not. Our grapevine becomes poisoned. 70% of organizational communication goes through your grapevine. Before the administrator has a chance to get out the memo, everybody already knows. And that's because human beings are so effective at communicating with each other. So there's nothing wrong with that, but you don't want your grapevine to be poisoned by misinformation, by rumors, by gossip. And because when that is happening, you become more and more unable to deal with complexity. And the last thing in the world you want to do is silence dissent in an organization or in a system. But in reality, it's rarely welcomed in the workplace. In a large study of a lot of different kinds of organizations, 70% of people were afraid to speak up about issues or problems at work. And these things become the undiscussables, the elephants in the room, the things that people talk about at the meetings after the meetings, and the meetings after the meetings after the meetings. And the elephant in the room analogy is a good one because you think about how many elephants can actually be in your meeting room. And the more elephants there are, the less room there is for you. And it's dangerous that the more you silence dissent, the more you lose all of the people who have some radar about danger. And we all have it, but different people are tuned into different kinds of danger. And if they do not feel safe to say, well, wait a minute, I don't think that's the way to go, then we are like lemmings going off the cliff. That's what happens. It's been shown in company after company, disaster after disaster, there were people who knew. NASA has studied this after the Challenger disaster. There were people that knew what was wrong, that knew there was a problem, but their dissent was silenced. And it is the most dangerous thing in an organization to promote an environment where everybody has to agree with everybody is really dangerous. Why social? I got to speed this up a little. Why social responsibility? Well, it's really about the issue of social justice and justice that we create. Again, because of this basic programming of reciprocity, we are basically programmed for justice. That's what reciprocity is about. Justice without power is futility. Power without justice is tyranny. And you are, in every one of your service organizations, you are dealing with people who have been unjustly treated from the time they were born, if not before. So this issue of justice and having conversations about it and talking about it and compromising about it and working it through become vitally important in all human relationships. And there are different definitions about it. And that's why you have to be committed to other commitments like nonviolence in order to really have that be part of what goes into deciding what is just. In organizations, there are different types of justice. There's distributive justice, which deals with who gets what, how resources are allocated. And there's procedural justice, which refers to how those decisions about allocations get decided. In any system, in any organization, including your family, as long as we feel that the procedure of determining outcomes was fair, we are likely to go along, even if we don't like it, with a lack of distributive justice or different distributive justice than we would prefer. But if we feel that the procedure was unfair, we will not trust anything. And it sabotages trust, and sabotages of trust lead to violence of some sort. And there's all kinds of ways that people are unfair to each other. And these are just some examples of workplace aggression that are really common and that create high fear environments that you really need to look at and you really need to react to. I already said that. Okay, why democracy? In this country, we talk a lot more about democracy than we actually practice it. So, and that's a problem because it's so vital to human survival in the upcoming years. Why? Because under crisis conditions, we as groups, in human groups, we become more authoritarian. And that means more top-down communication, less bottom-up communication. And we put more and more emphasis on somebody at the top telling everybody else what to do. And the fundamental problem with that is that because of the complex nature of the problems that confront us everywhere, there is and never will be one human being smart enough to figure those problems out. So the more authoritarian we become, the more incapable of solving complex problems we become. So it's a real danger not to commit to more democratic practices everywhere. Under stress, become more authoritarian and less democratic. Now let me define what we mean by democratic. It represents the ideal of a cohesive community of people living and working together and finding fair, nonviolent ways to reconcile conflicts. It does not mean everybody gets a vote on everything, which would completely paralyze you in an organization. We're not anywhere at the point at which we can do consensus kind of decision making. We don't have that skill set yet. It takes a long time to learn how to really practice real democratic, deep democratic practice. And we need to develop the skill set. We need it because it provides a social immunity to abuse of power. We need it because people support what they help to create. And if we haven't helped to create it, we're not likely to support it. That's the nature of who we are. We need leaders who know how to promote democratic practice, and we need it because we need new solutions. We need them bad, we need them fast. We can't wait around any longer. So Sanctuary is committed to deep democracy, and it means that it's an awareness on everybody's part that all people, parts, ideas, and feelings are necessary in moment-to-moment interactions and in institutional practice. So as a democratic leader, you know, your basic assumption is the more people I get involved in this decision, the better the decision will be. Time will only, around this particular problem, I have to decide by this afternoon. So there's only 3 people I can ask because everybody else is out. And that's what I'm going to do because I got to get the decision made. But the place where I come from is participation. So participation always has to be combined with reality and what the real needs are. But if you come from a commitment to democratic practice, and that's what everybody shares, then whenever you can, you will get the maximum participation. And that means you'll get better solutions to complex problems. More worker participation looks like there's a whole lot more communication going on. It looks like there's a lot more complex interaction and coordination. It means there's a lot more information richness. It means that there's a greater commitment to actually do what we plan. People support what they help to create. It means there's more productive conflict. And that means that you're going to see more innovation and creativity. And you never know where that's going to come from. Might come from the most educated, might come from the least educated. Might come from the youngest, might come from the oldest. You just never know until that's what's so exciting about group work, is that you never know as long as there's trust, then you never know where the creativity spark is going to emerge. There are 3 primary functions of democratic leadership: to distribute responsibility within any group, to empower all people to give their voice, and to aid the group in its deliberation. Not to tell everybody what to do. Not to know ahead of time what all the answers are. And that's the burden we place on leaders, and why we often get such lousy leaders, is that we expect the ridiculous. We expect them to know ahead of time to tell us what to do, and they don't know. That's not the way there is going to be any solution to the problems that we have. It isn't going to come from that way. It's a very different way of practicing. And we view democracy, democratic participation, as the antidote to what happens to traumatized people. That it requires process and patience, It requires you to manage your emotions and to control your impulses, because when somebody disagrees with you, you can't just jump up and choke them. It requires using words as a substitute for action. It requires shared decision-making, shared problem-solving, the development of social skills. It means minimizing the abusive use of power, all that bullying that goes on all the time. It means people having a voice and being empowered to put their best effort forth. It means everybody participates. It's the demonstration in action of fair play and restorative justice. You have to build trust to really practice democratically, and you have to learn how to negotiate, how to make concessions, and how to compromise. And all of these are things that chronically traumatized people have a lot of trouble with. And we're all chronically traumatized. So we all have trouble. And if we're not careful, we're going to lose our democratic system. And the last commitment is to growth and change. And that embodies two main domains of recovery from anything. The first one is loss. So all change involves loss. There's no way that you can change something without losing something. It's just a basic fact of life. And it doesn't matter, even wonderful things. If you can be madly in love and marry the person that you're in love with, but you just gave up your single life. You can be happy as anything to have a child, but you just gave up a lot of freedom. So it doesn't matter. All change involves loss. And if you want your system to change, then you're going to have to get energy from somewhere, and the energy has to come from the future. Why in the world would anybody go to college, go through exams, pay all that money, if they didn't have a vision of where they want to get as a result of going to school? You wouldn't do it. Nobody'd do it. You wouldn't put money away. You'd just spend it right away. So there's what helps move systems and people through loss and a willingness to change is they want to get to something. There's something they want in the future, and in order to get it, they're going to have to let go here. The tricky part is you always have to let go here before you get that. So whenever you see resistance to change in your organization or in your system, you have to ask, what are they going to have to give up? And how are we going to compensate for that? How are we going to encourage the vision of what they're going to get? But it's just human nature that unless we're going to get something, why would we be so stupid to give up what we already got? It's just kind of basic common sense that we don't really think about. Organizations experience loss as a whole, and there are all kinds of things very similar to trauma, the things that cause trauma, that cause grief in organizations, but including firings, departures of key people. And it's important if you're a manager to realize that you may be really happy to see somebody gone, but that person was connected to somebody in that organization. And so there are going to be mixed feelings all the time about that because we are interconnected. And all these things cause loss. And when you see them, if the loss isn't resolved, then an organization or a system is less likely to be willing to move because they get stuck in grief. And if you don't resolve grief, then the organization becomes stagnant. Losses to an organization are likely to experience individually as well as collectively. And we can experience that as a failure of our systems to live up to what collectively and individually we expected them to do. And that can really shatter people at a very deep level, a loss of certainty and a loss of meaning, because we expect our institutions to take care of us. That's why who here is in child protection? No, there were some people yesterday. That when a child dies who's been in child protective custody, the whole culture roars up and says, how could you let this kid die? And indeed, individual people may have made mistakes, but it's also a reflection of how we expect our institutions to care for all the problems we don't really want to pay attention to. And in this case, the welfare of children. The relationship between employee and organization are deep-seated, largely unconscious, intimately connected to the development of identity, and have emotional content. So if your organization, oh, I don't want to do this. I'm going to skip that. There, that's what I want to get to. So, the managing from the future piece for what the community collaboration you guys are talking about is really vitally important. You have to spend a good amount of time, and that will be early steps in developing a shared vision of where you'd like to get to. What would you like to really have happen? And then you manage from that position. We have this vision of where we are in 2020. And we're there now. We've got it. Whatever that is. What did we have to do in 2010 and 2011 and 2012 to get there? Rather than focusing on how you're going to get everybody, because that's just not the way group change occurs. How can you make it possible for people who are able and willing to make that shift in underlying assumptions to make it together more quickly and with the least amount of pain? Those are the questions you really want to think about. So it's how do you get that tipping point that Malcolm Gladwell talks about? And it doesn't require everybody. It does require people with good heart and a sense of mission to do it. Changing culture is a process. So you have to identify the norms, you have to commit to a set of shared values, and you have to make those norms universally known. They have to be really explicit, and you have to envision together where you want to get. Then you have to choose warning signs for when your culture's slipping. What are indicators that it's not going on the route you want it to go into the future? And then you have to monitor it. So dealing with a system as a living system means it's not a machine that you can just tune up, and it's okay then. That's not the way living systems work. It's like you can't have dinner with your family one day and say, okay, I did that. Don't have to do that for another year. Doesn't work. Doesn't work with organizations. We need that steady, constant monitoring because we're live. It's like monitoring your health. You have to be doing that all the time. The way we think about that is that we use the commitments to be the shared norms. And then the method that we're using is we have a steering committee comes to a 5-day training about all of this stuff and more that we've been talking about. And then the steering committee goes back. This is what's happened at Baker Victory. A steering committee goes back and creates a much larger representational core team. And then the core team works out how they're going to work through the method that we're developing. And it's manualized, but it's really a manual to create a process within an organization. And then we have a toolkit that goes along with it. But and I don't have time to spend a lot on that. What I do want to tell you about, because it might be useful to you, is self. What I'm talking about is so complex that you kind of need a compass through the territory. And what emerged from our work with trauma survivors that we've then applied to organizations is this notion of self. It's an acronym. It stands for safety, emotions, loss, and future. And it isn't stages. It's really a problem-solving tool. That if you use all 4 of those to address any problem, you will cover all the bases you need to cover. But it looks more like that. It's really circles. It's called a nonlinear change process. It's not a straight line. You keep going back. So you look at your safety issues. And how are safety issues affected by our inability to manage emotions? And how is our inability to manage emotions related to our fear of change or the losses that we've had. And how does that relate to the fact that we have not really envisioned the future we want to get to? But to get to that future, we're going to have to make some changes in how we define how we're safe together. And to do that, we're going to have to learn how to be better about talking about and communicating about emotion and so forth. Okay. When we talk about safety in sanctuary, we talk about 4 domains. Physical safety is the most basic, but if you don't have psychological safety, social safety, and moral safety, you will not have a safe organization or a safe relationship. You have to pay attention to all 4 domains of safety in order to really be safe. Physical safety has a lot to do with boundaries. Psychological safety has a lot to do with self-functions and self-respect and giving other people respect and expecting that people will carry their share. And social safety is how do we feel safe with each other. It's all these functions. Moral safety is really about moral intelligence. And that's our mental capacity to determine how universal human principles like those embodied by the Golden Rule should be applied to our own values, goals, and actions. And it involves 4 key principles: integrity, responsibility, compassion, and forgiveness. So examples of moral competency, having a guiding awareness of personal values and goals. Being able to voice views that are unpopular and go out on a limb for what you think is right, and in a community feeling safe enough to do that. Acting ethically and above reproach. Building trust through reliability and being authentic. Being able to admit our own mistakes and confront unethical practices in other people. Taking tough principle stands even when they're unpopular. It's hard. Moral safety is hard. It means having a system of values that are consistent, that guide behavior, and they're based on a deep respect for oneself, other people, and all living things. And I've talked about all this already. So sanctuary is about creating and sustaining an ethical organizational climate. And that's really the bottom line. It reflects the values of those who run the organization. It emerges in the way leaders transmit expectations about the way everybody else is to treat themselves and each other and their clients, as well as in the ways social responsibility is to be exercised. The values of top leadership have to be conveyed throughout the organization, through middle management and into everybody else. It includes how people perceive others in the system, individuals' perception of how others in the system typically address moral issues, and it helps to determine how each person does address those issues. And where there is great inconsistency between value systems, it's a breeding ground for split ethical climates. And that can lead to acute and chronic collective disturbance, and that will lead to violence. Violence has an evolutionary path. It doesn't just happen. There are always reasons why violence emerges. And to commit to nonviolence, you have to be willing to look, to learn about how that happens and to change it. Emotional management is about creating a safe environment, and you can't do that unless there are emotional management skills in individuals and in the organization as a whole. And that means we have to look at many of our practices in organizations as ways we contain and help each other manage difficult emotions. We use self for everything. We use it for treatment planning, problem solving, psychoeducation. We use it to frame everything. Think of it like a compass, north, south, east, and west. It's incredibly helpful. And I think I told you that is... so what we do, we have the Institute. We do the people who attend the Institute create a core team. Then we provide technical assistance. That's what Baker Victory has been going through this process. It's really a 3-year process minimum. System change actually takes about at least 7 years. We're trying to accelerate the process. But as anybody from Baker Victory will tell you, it is challenging and difficult. There's no easy road about this. We're just very early in the evolutionary experience of knowing how to function effectively, collectively, and consciously. And then programs, so we now have some programs that have been in long enough to have gotten certified. So it's a whole process. And any organization that does this training becomes part of a network of programs. So we're trying to network people together to talk to each other. And we're kind of doing it all over the place. And I don't want to do the research, but I do want to show you this. Let me see if I can find this. Has anybody seen this from the internet? The train station. It's a good thing to think about when you're really frustrated at your community collaboration. Let me see if I can find it. No, I can't find it. Sorry. You go on YouTube and put in what's her name? Oh, doe, a deer, a female deer. You know what's that? Julie Andrews. Put that into your search engine on YouTube, and you will find this video clip, and you will enjoy it. And I'm sorry, I don't know where it is because I switched computers. It'll say Do Re Mi, Julie Andrews. And I think it's a train station. You'll get a kick out of what happens. All right, I'm going to finish. I'm about out of steam. Thank you very much for your attention. I think, Katie, you going to facilitate this part?